Hello and welcome to the Prepared and More YouTube channel. Today we're set up talking about medical kits and medical supplies. I'm an EMT, and what kind of brought around this question is I carry a bag with me. I also have another bag that I have at home, but my son, who's a new EMT, he wanted a bag to carry in his vehicle. And so we started talking through the different things that we might want in a bag to carry in our vehicle. And we determined that there's really not a one-size-fits-all bag. Yeah, you can buy these pre-made bags, and we'll actually have a link to a good pre-made bag down in the description, but many times it's cheaper and better for you to kind of build your own bag. And so we're going to talk about some things that you may or may not want in your bag, and it's really dependent upon the types of emergencies that you think you may encounter. As EMT responders, we may roll up on a car accident or something like that, or we may have a car accident ourselves. What things would we want in our bag for our skill level? But if you are not an EMT and you're just a parent or a person who just wants to be prepared, the things you put in your bag are going to be dependent upon your training and your skill level, but also your needs. If you have a particular diagnosis, illnesses, diseases, situations that you're going to be encountering, you may want some specific items for those specific situations. And so you kind of design your bag to do what you want. This bag here is my son's bag, and it's actually just picked it up. We'll have a link to it down in the description. But a very economical bag, a great price, and it really has a lot of stuff in there. And actually, of the three bags, this is actually the bag I like the best. And so we're going to talk about the stuff he has in it, as well as some of the stuff that we've kind of scattered across the table here. So we're just going to kind of start on this side and work our way across and kind of describing to you some things that you may want to consider having in your bag. First thing we got here is what is it's a brand name, but it's commonly called a SAM splint. And a SAM splint, this one's folded up nice and new and in the package, and it's multicolored. But basically, this is what it is. It is a piece of thin aluminum with foam on both sides. And so here it is, kind of a rolled up used one that we use for training, but this can be used, it can be shaped and molded, and it'll keep its shape, but for any type of a splint. So a leg splint, an arm splint, a wrist splint, anything like that. There's a lot of uses for this, and I actually recommend a SAM splint inside any medical kit. These can actually be cut with our trauma shears that we'll show you here in a minute. And so these are just a great device. They're not super expensive, so we recommend a SAM splint. By the way, all the items we talk about, we already mentioned the bags and the pre-made kit, but we'll have links to all these different items that you can find down in the description there. Gauze. There's a variety of gauzes. This one's called a bleed stop bandage. This one doesn't have anything special in it, but it's just the cuts and the different sizes and shapes that are in there are specific for stopping bleeding. But you have those types of gauze. We have ABD pads, which are called abdominal pads, but it's just a thick gauze that you can use for stopping bleeding. It's got smaller gauze pads in here. These are eye pads in particular. We've got all kinds of, he's got roller gauze, both little tiny stuff and a little bit bigger stuff, but a variety of gauze, different shapes, sizes, types of gauze is really important. You're going to use that for stopping bleeding. You're going to use that for different types of wounds and bandaging. So a good variety of gauze. The other thing I will recommend, and the gauze, by the way, is very inexpensive, and absolutely get the kind in the individual packaging, and it's wrapped up and keep it in good condition. It'll last for a long time, but when it does start to yellow, that's probably when you need to throw it out and replace it. But the other type, and these are a little more expensive. I mean, these things are going to be $10 to $20 a package, but these are, there's different brands. This is C-Lox, Cell Rapid Blood Stop. This is Quick Clot Rapid Blood Stop, but these have actual powders impregnated into these gauze that actually clot with blood intentionally. And so these are absolutely fabulous for someone who's bleeding a lot and you can't get it to stop with just normal gauze or normal direct pressure. You can put a blood stop bandage on those. Again, great thing to have around for significant bleeding trauma, but they are a little more expensive. There's several different brands. We'll link to those. Again, kind of continuing across, we have our basic CPR masks. I know a lot of the CPR training that's coming out now for lay responders is hands-only CPR. and that is good. For the first few minutes, hands-on CPR is extremely effective until a more advanced personnel can arrive. But if you do want to do rescue breaths, then some type of a mask. This particular one has both an adult and a pediatric mask for infants, and so these are great to keep around. You know, with an infant, people are a lot more likely to just use their mouth on there. But for adults, we certainly want a mask to keep body fluids from being contaminated. So a mask, I just keep some Kleenex in mine. It's an optional thing, but you never know when you're gonna need Kleenex. You can use them for blowing your nose or any type of cleanup type job, or also just for an alternative to gauze if you needed it. Gloves, absolutely important, and you pick the size of gloves that fit yourself or the people that will be using your med kit, and keep several pairs of those. I just throw some here in a Ziploc bag, get the air out of it, and throw it in my med kit. It's real handy there. Light, you always want extra light on scene, particularly if an event happens at night. But I've got a headlamp that I use that's great when you're working on scene at night and you need your hands free. You can put it on your head. Also got just a good tactical flashlight or a pen light that can be used to check pupils and those types of things. So those are all options. You don't necessarily have to have all three, but you want some good light options. A little notepad and a pen. It's always great for writing down vital information. Again, as EMTs, we have to document what we do, so we need names and date of births and addresses and vital signs and all that. You may not need that, but you never know when a good pen or pencil and a notepad will come in handy. Again, working across the back side of the table here, we have some medications. Aspirin is always good. We give 324 or 325 milligrams of aspirin for someone that is not allergic to aspirin, that is experiencing chest pain. That will commonly be a 911 protocol, so they will walk you through that type of thing. But if you have the aspirin available, that's good. Typically, children's aspirin is best. Those are 81 milligrams, and you take 4 of those. But this is adult aspirin, that will work too. It's chewed up. But to make sure, it's important, a couple of things, that the aspirin is not expired. That's really important with aspirin. And then the other thing is make sure the person's not allergic to aspirin. That's really important in the 911 protocol. When you're on the phone with 911, they can work you through that. Other medications that I commonly carry in mine, and I've got the little, these are little dispensers, and I picked this up at Walmart, and so each little one comes apart and you can put different things in there. And I have used the label maker to put some labels on it, but I put Pepto in mine, just Pepto-Bismol. Again, not necessarily a huge emergency, but something that when you need it, certainly helpful to have. I have Benadryl, again, really important medication to keep around. A lot of people have allergic reactions. Make sure that they're good with taking Benadryl. I have an antacid. I got acetaminophen. You may want ibuprofen, some kind of a painkiller, but just a variety of medications. And I rotate these out to make sure that they're fresh pills inside there. Easy to get to, easily labeled. I know exactly what's in there. An EpiPen, that's what this thing is if you're not familiar with it. People who have severe allergic reactions to certain things, maybe a bee sting or a certain kind of food, maybe nut allergies or something like that, they will be prescribed these. And so if you or your family member is prescribed an EpiPen, you may want to keep one inside your first aid kit. Again, these should only be used for people who are prescribed them. And then you can keep that. A doctor writes a prescription, you can fill that prescription, you can keep it available to you. That's important to those people. Next thing on my table is a tourniquet. And these are commonly called SWAT tourniquets, but very easy to use. You can actually even use one on yourself, but it simply comes apart. You can slide it on an arm, you put it above the wound, and you simply Velcro it back to itself, and then you twist this till it's really, really tight. It cuts off bleeding and circulation, and then you simply put it inside this to hold it in place. The key thing about tourniquets is make sure that you've tried direct pressure and those types of things before you put on a tourniquet, and make sure you've got just general first aid training about use of tourniquets. When you're done, if I put it on this arm, I should have no pulse and the bleeding should be stopped. Need to mark the time that I put that on there and make sure that person gets to an ER quickly. Do not ever remove a tourniquet once it's been applied. Let the hospital do that. But this is what they come like and new in the package, and I keep 1 or 2 inside my med kits for major bleeding trauma on the legs or the arms. Other items in our bag, again, looking at my son's bag here in the top, he keeps his vital signs and those types of things that he'll need up here. So this is a blood pressure cuff. Again, a great skill you can learn for prepping. Learn how to take blood pressure. That's important. So I have a blood pressure cuff up here. We have a stethoscope to be used with that or for listening to lung sounds. Also in here we have a pulse oximeter, a great new technology that I recommend you pick up. It's just an electronic item that goes on somebody's finger, tell them their pulse as well as how well they're getting oxygen through their system. A great little tool. Make sure you check the batteries on these periodically that they're good. The other thing he's got up here is he's got some gloves. So those are items that he would use for assessment and in first arriving to help somebody. So those are important. Let's see what's in his next compartment down here. We've already talked about some of the stuff down here. We've got a lot of his bandages. In addition to that, he's got some Q-tips. He's got cotton balls. He's got some hand sanitizer. Got some, looks like alcohol prep pads, so for cleaning the area. Inside here, it looks like he's got a variety of things. He's got antiseptic towelettes and other types of wet wipe type things that commonly come in first aid kits. Those are good. Then over here, he's got triangular bandages. If you needed to form a splint or something to hold it next to somebody, that would be good. And here, probably one of the most important things he has is very simple. It's just a variety of bandages, very different sizes and shapes, and in this case, colors. But particularly if you have a lot of kids in the house and that type of thing, you'll run through these quickly, so keep them in your kit. We've got some small rolls of tape. We have some ACE bandages, elastic bandages, larger rolls of tape, and again, he has his SAM splint in this particular compartment. His next compartment, his family in particular, has people who are diabetic. So he's got his diabetic supplies in here. He uses, keeps some different candy items. So candies, just simple candies, cheap candies, as well as some type of granola bars that would be helpful for diabetic emergencies. He's also got some bottles of water that he keeps in here that can be helpful in a variety of situations. Anything from cleaning a wound to actually giving water to someone who's dehydrated. That can be very helpful there. It's also got cold packs. These are the instant cold packs, as well as he's got the emergency space blankets, which I had my doubts at one point in time, does this actually work? And genuinely they do. They do hold in heat. They reflect your own natural body heat back to your body. And these emergency space blankets do work. Recommend you have them in your kit. So those are some of the items that he's got in his bag. And let's see what's over here in this one. This one's got his airways. It's a great one. He's also got his tourniquets in here. But these are called oropharyngeal airways. And this is an EMT type thing. So you wouldn't normally have this in your kit unless you are trained to use it. But they would help in CPR and instances where you have a compromised airway to make sure you can help someone breathe. So those are some basic contents of first aid kits. You may actually have some items that you would recommend that we didn't include in our kit. Put those in the comments down below. We're open to suggestions. And again, build your kit for your basic needs. The last thing we want to talk about, always like to recommend a good book. And we'll have the link to this book down in the description. But The Ultimate Survival Medicine Guide, Emergency Preparedness for Any Disaster, by who's commonly called Dr. Joe and Nurse Amy. It's Joseph Alton, MD, and Amy Alton, nurse. Great book to have, and we'll put the link to that, but it just kind of goes along with all this stuff. What do you need to do in an emergency? So thank you for watching today. Please like and subscribe to our YouTube channel. Put some comments down below to let us know what extra stuff we may need, and always be preparing. Thank you.